Hi everyone, my name is Danielle. I'm going to be doing my project on measles. So, to go ahead and get started on the introduction of measles and what it is, it's a highly contagious disease, an acute respiratory infection. It's caused by a virus, and we'll get into more detail about that throughout the later slides. And it's also spread through airborne droplets. History of measles. In 1912, measles became a nationally reportable or notifiable disease in the United States, in which it required healthcare providers and labs to report all diagnosed cases. And within the first 10 years of reporting, an average of 6,000 measles cases related and deaths that were reported each year. A vaccine became available in 1963. However, 10 years prior to that, almost all children got measles by the time they were age 15, in which this estimated 3 to 4 million people in the United States that were infected each year. Among reported measles cases each year, an estimated 400 to 500 people did die. And then 48,000 people were hospitalized, and then about 1,000 suffered from swelling of the brain, also called encephalitis. Um, a better and more improved vaccine did become developed in 1968, and this is actually now the only MMR vaccine used in the United States since 1968 for measles. More recent history of measles. How did measles get its name? So, Middle Dutch words meaning blemish or blood blister that refers to red spots that may appear on the skin, or Middle English meaning leper because it was once mistaken for leprosy because of similarities. The name comes from the disease characteristic spots and the very sickly look that it can give off to those infected children with measles. Signs and symptoms of measles could be high fever, cough, runny nose, red rash, fatigue, muscle aches, red watery eyes. It can be different in people. It's not always the same, but these are the most common signs and symptoms of measles. How does this pathogen cause disease? It's caused by a single-stranded enveloped RNA virus with one serotype. A It is a member of the genus Morbillivirus in the Paramyxoideae family. Um, the only natural host of measles virus are actually humans, and surfaces or air can remain infectious for hours as well. So this is another slide talking about the pathophysiology, and we're just going to continue that. So the primary site of infection would be the alveolar macrophages or dendritic cells. Measles is transmitted to the epithelial cells, and following amplification in the epithelia, the virus is then released into the respiratory tract. How is measles identified in the laboratory? It's identified mainly through nasopharyngeal or throat swabs, but also serum specimens. There's two types of testing that's used primarily. That would be the serology testing and the real-time PCR or RT-PCR testing. So with the serology testing, detection of the IgM antibodies in a serum where the specimens are collected within those first couple of days of rash onset, this can give evidence of a current or even recent measles virus infection. And this comes from serum specimens. And then you have your RT-PCR or your real-time PCR testing, and that is detecting measles RNA from your clinical specimens. So, your specimen for this type of testing would be those nasopharyngeal or even throat swabs, and also even urine specimens. However, in this case, for the most part, nasopharyngeal and throat swabs are the most used. Um, I do have a note at the bottom here that selective media are not used to identify measles because measles is a virus and it cannot grow on a bacterial culture media. However, certain stains may be used, but the primary identification, again, as stated before, would be the two options listed above, the serology testing and the real-time. So, how's measles treated short term? Really, it's treated by managing the symptoms for the most part, preventing complications through the course of the virus. Complications might include like pneumonia or encephalitis and things like that. You want to avoid that and try to prevent it. Um, Rest, increasing fluid intake, and fever reducing medications like Tylenol or ibuprofen. And this would kind of just be the main focus of short term treatment for measles. So, as for your long term, how is it treated? There's not necessarily a long term cure, as really there's not a cure. Measles is a viral infection that usually runs its course within 10 to a 14-day window. And then it's given kind of after you've been infected and after you've had measles. Typically, your immunity thereafter is lifelong. And management is very similar to short term treatment. It's just treating your symptoms, rest, fluid intake, fever reducing medications, and so forth. Interesting facts about measles. It is one of the largest uh, contagious diseases in the world. The MMR vaccine that was created for measles actually led to elimination in the United States of the disease in 2000. This disease can cause pneumonia complications, encephalitis, which would be swelling of the brain, hearing loss, and even death. It also affects mainly unvaccinated young children. Prevention for measles will be vaccination with the MMR vaccine, in which it provides nearly complete protection after 2 doses of it. And it's also known if you do have 2 doses of it, you automatically have presumptive immunity. Performing good hand hygiene, avoiding contact with any confirmed infected persons or sick people. Post exposure, so if you are exposed, vaccination um, is recommended within those 3 days of your exposure. So that's really important there as well. Respiratory etiquette, as well as mask encouragement in certain settings, in settings like nursing homes, hospitals, emergency departments, especially during the peak seasons of winter. And these are my references that I used